Hi, everybody. Welcome to our first of a handful of SmartEnroll walkthroughs. We're going to try to make these different week to week as we approach the annual enrollment period. The goal is to show how to use SmartEnroll while also laying out some different scenarios that you might run into. We're going to try to make it interesting to show you as many potential avenues that you might have to take as possible. With me, my co-presenter today is Dave Yost. Dave, can you say hi?
Hello, everybody.
And before getting in, I just want to show you on TLC Agent Hub. We're not going to show the entire client meeting process. We're really going to focus on SmartEnroll specifically. If you want to learn how to do the client meeting, there is on Agent Hub under training, there's a 4-part course that we created that walks you through everything that you need to do before the meeting, during the meeting, and after the meeting. This session today is specifically about SmartEnroll. And if you're new to the Medicare insurance world, you're new to TLC, SmartEnroll is TLC's exclusive enrollment platform. It is maintained and operated by Connecture. That is the same company that maintains, operates, and created Medicare.gov. So we're pulling real data from that database, which does make this platform very credible. It has a lot of good features. There's definitely things that, some people might like different about another platform that they've used, but that's just normal with technology. We're going to go ahead and dive in, and we will cover some of the basics. So I want to start off with how you create a profile. It's pretty easy. If you just look at the screen, you can pretty much figure it out, never having been in here before. Look, new profile. You click plus. And we're going to go to new beneficiary. When I click that, I have 2 options: create a new beneficiary or new beneficiary via RetireFlow. RetireFlow is a third-party application that allows me to send an enrollment survey, or not an enrollment survey, but a demographic survey to a potential client. It'll ask their name, their contact information, their medications, their doctors. It completes the scope of appointment. That is an additional cost. So TLC provides all of our affiliates with SmartEnroll at no cost. RetireFlow is a paid product. If you're just getting started, or you only have 40 or 50, maybe even only 100 clients, I'm not sure you need that at this point in time because there's a cost associated with it. When you get to the point where you have a lot of reviews to do, it's a great tool to help make this process easier. So when you're initially creating a profile for a client, you do have to enter a zip code. And we're going to go ahead and we'll just do my zip code. And it's going to show Mahoning County. If you have multiple counties in a zip code, it will give you the option to pick a county. And I have myself in here a lot of times. So Dave, I'm going to put you in here today. And then we do have to enter a date of birth if we want this to go well. So let's do 8/30. Oops. 08/30. We'll do 1957. So to create the profile, you only have to enter the zip code, first and last name. But ideally, the more information you enter here, the better the process is going to go for you as far as sending and receiving the scope of appointment form. I'm going to go ahead and add an email address, phone number. Apologize here. Try to mute myself and turned off the screen. I'm coughing quite a bit today with these allergies. So here we are back in here. So name, birth date, email address, phone number. And then we're going to add the address. You don't have to add the address again, but if you do, you're going to save your client having to do so when you send out the scope of appointment form. And this makes it easier for your client to complete the scope of appointment form on their phone because I'm entering information that saves them from having to enter it on that small screen. So there we go. And I like to do this at the time of creating the appointment. So If you're scheduling that appointment over the phone, you can do this right over the phone. We can click save. And then the next thing we can do while we're scheduling that appointment is at the bottom. We can go forward to scope of appointment, continue to SOA. Because I entered that information, I can click email or text and send the scope of appointment form to my client. If I only did name and zip code on this screen, now I have to add an email address or a phone number. So you see how this starts to help you along the way. So I'm going to go ahead and click email, scope of appointment. It's going to email it to me. There we go. And it's going to pop up with this screen that's going to give me the ability to add a task for follow-up. It will add it on my home screen in SmartEnroll. I'll show you that later. I'm going to go ahead and click add task. Close that out. And let me show you what that email is going to look like real quick. It's going to come right to my inbox. Here it is. This is what your client will receive via email, very similar on text. They go ahead and click complete scope of appointment form. So this is the client side. I think it makes sense to walk through this with them on the phone if you have the ability while you're scheduling the appointment. And what we have is make sure to tell them to check all of these products. If they check all four, I can go over Advantage, Part D plans, supplements, hospital indemnity, vision, dental. If they only check Medicare supplement plans and they come to meet with me, I have to get a whole new scope of appointment form. Now down here, you will see because I entered, this is why I wanted to enter in their contact information for them. It's already here for them. They don't have to re-enter it. They're going to check this box here. They're going to ask you about this. Everybody gets confused about the authorized representative question. That's always going to be no unless you're working with somebody's legal guardian or power of attorney. They click submit form. They get a nice reminder screen of some of the things that they should bring with them to the meeting. And then back in SmartEnroll, if I click refresh, I now have that form back to myself as the agent. I click complete form. I have to go ahead and add the initial method of contact. I'll put referral. I, as the agent, also will check all four products, providing that's what me and the client have agreed to. I check the signature box and I click submit. Now I have a compliant scope of appointment form completed. You see that here with the green check. I click view if I want to take a look at that completed document. It'll let me download a PDF if I want to print that and put it into a file for my client. Now that I've done that digitally, SmartEnroll will house that for me for 10 years plus the year of enrollment automatically. So my record keeping is taken care of. And so one of the questions that I'm getting real time here as we go is, what do we recommend for somebody that is in person who wants to sign on paper? Now, unless, excuse me 1 second. Dave, do you want to go ahead and talk about that? I'm going to get a cough drop here real quick.
Yeah, sure. So for people who want to do a paper scope of appointment, I mean, if we have to, we'll mail it out to them. We just make sure we get it back within 48 hours before the meeting. If they happen to just come into the office and maybe they're going over a claim on an auto policy or getting a quote on another product, and they want to come in and schedule a meeting to talk to you about Medicare products, they could be considered a walk-in at that point if there wasn't a scheduled meeting, and they can fill out a scope of appointment on the spot, have the meeting the same day as a walk-in. The walk-ins are people who are unplanned. So it's not that you scheduled a meeting, they couldn't figure it out electronically. So you just mark them as a walk-in when they come in. We want to try as much as we can to get that mailed out to them if they can't do it I wouldn't upset the customer over that and not schedule the appointment at all. There's ways that we can get it in their hands through paper. But yeah, walk-ins are for people who are unplanned. We would typically try and mail it out to them if they can't do it electronically. You can also try a phone scope of appointment. There's the option to do it on SmartEnroll. However, it hasn't officially been approved by CMS on the SmartEnroll platform. So if it's ever called and requested from a carrier for whatever reason, technically it's not officially approved by CMS. So you could use the carrier sites that have the opportunity to do a telesales scope of appointment. We typically would use United Healthcare. You could write a different company's product, but United Healthcare's Jarvis site has a compliant and pretty easy to use telephone scope of appointment if necessary.
Well, Dave, I know you and I were talking about this earlier. It does look like that disclaimer has been removed, but they did add in here that we have to use a recorded call to complete this. Regardless, we're not fans of doing the scope of appointment over the phone for a variety of reasons. We work with a lot of clients doing AEP reviews, and they all seem to handle the text signature very, very well. Would you agree, Dave?
Oh, yeah.
So if somebody walks in and you need a physical form, you can print the form right here. And then you can upload the completed form into SmartEnroll by clicking the upload button under that client's profile. Dave, anything else you want to add on scope of appointments here?
No, I think that's good. You can use the same scope for a full year, correct?
Yeah, we get 12 months for that scope of appointment. And, it works out pretty well. It's just to reiterate, don't be afraid to try to ask your client to sign it by text. I have clients well into their 80s who can do that just fine. As Dave said, second option, mail them the physical form. Third option, we can try that phone, but it's not the ideal. While we're here, you do have the ability, if you don't have a recording solution for your sales and enrollments, in SmartEnroll, you can start a call recording by clicking up here, start call recording. We'll see if it loads right now. The important thing here is to tell your client that it will not be your phone number. It will be this number that they give you. Whatever they give you here is what you have to advise your client it will be. But I can make the call by clicking this, and it will let me call right now from my computer, and the call is actually in progress. But I'm going to end that for the sake of our presentation. It's that easy. You heard the phone ringing probably. So any of you that have access to SmartEnroll, you have a built-in caller, and it will save that recording for you. Not too bad, pretty cool, right? So that's the scope of appointment process. It does take a little bit of time to just get used to that flow. I know Dave and myself and our team and a lot of the agents that we work with, we all try to do that when we schedule the appointment. Now, if you have a walk-in, they come in, you can have a pile of these papers available. They still have to complete the form. So you can't just skip it. You have them complete it, and you just note that it was a walk-in, and that's why the date and the meeting date are the same time. Perfectly okay. That's one of the permissible exemptions to the 48-hour rule. So from there, we've done the scope of appointment. Let me go ahead and sign this. It's not going to let me move forward without it. Oops. One second. Oh, that's the phone one. What did I do here, Dave? Let's go. Okay, forward. So we complete the scope of appointment form, and then we can continue. Oh my goodness. Give me 1 second. Give me 1 second. We want to go to add preferences here at the bottom. So this is a little bit of a different look for those of you that have used this previously. So some other updates have changed. We can click add providers. I think this is actually an easier workflow, by the way. So we can go ahead and put in a provider's name. Just ask them their doctors. You look the doctor up. Huh. Okay. While I'm experiencing tech issues, fair warning. Between now and October 1st, you may experience tech issues when you're looking and playing around in this platform. And the reason is updates. So it's that time of year where they're pushing out new updates and changes ahead of AEP. It could work a little slower. Things could be in a slightly different place. Just stay calm, carry on, take your time, find what you're looking for by being patient, okay? It's going to happen for sure. So we can search doctors and go in and add those providers to the list. We'll just do a couple here for you. Very easy. Now, Dave, if you want to chime in on this, feel free, but we typically put in doctors for searching terms and filtering terms of plans, but we generally always go to the carrier site to screen doctors. What are some of the reasons in your experience that that's a good thing to do, Dave?
Well, it's not 100% accurate. And it's usually that on SmartEnroll, some of the doctors might not show up in the network when they actually are. So we like to confirm that through the carrier's website. But you might pull up a doctor and it'll show 4 or 5 different locations. Like, you're like, geez, this guy's only been at one location since I've known him for the last 15 years. How's there so many different locations? Well, if he was ever at a different location, or if the group that doctor is part of has multiple offices, sometimes they'll show up in many different locations, but only one is actually in network because it's the only place that they work out of. So if you happen to click the wrong location, it could show up out of network. If it's a dentist or an eye doctor, many of the Advantage plans use third-party networks for their dentists and eye doctors, and SmartEnroll is not going to go multiple layers deep, transferring to different websites beyond, say, Blue Cross Blue Shield or United Healthcare's website to pull up a dentist or an eye doctor. So they typically won't show up in the network. It's a guide for us, and it's a good record to keep of the doctors that they told you they need to confirm are in network. That way, if they come back and say, hey, Dr. Brown's not in the network and you signed me up for this plan, well, you didn't tell me that Dr. Brown is someone you saw. So now you've got a record of all the people that you've discussed and that you had to double check to make sure we're covered.
Exactly right. And point in case happening right now, this is my doctor's last name. He is not showing up in the network. And I know he's in the network with every plan in the area. So sometimes these practices, they could be updating their contract with the carrier. You could have somebody in the practice who didn't turn in one document or read that email and do that DocuSign, and then that practice doesn't show up. So we as agents a lot of times end up being the ones that advise doctors that they're not showing up in network. Or we'll have our clients do that. So we trust this. It helps us filter, but we verify by going to the carrier sites, which will show you how easy it is to get there. So I added 3 doctors. I don't know who any of these are other than Ambrose. He's one of my neighbors. I'm going to close this out. You see the check mark here. We've added 3 providers. Let's add pharmacies. Dave, do you want to talk about our method and how we determine what pharmacies to add? Well, I add a few here.
Yeah, I like to add three of them in almost every case, just so we get a comparison of multiple networks. And sometimes pharmacies could be preferred or standard with a certain company. But you'll quickly realize, especially on the standalone drug plans, like WellCare, they've got kind of their core group of pharmacies that are going to be preferred cost sharing across the country. Well, if you go with Cigna, it's a different group of preferred pharmacies. If you go with Aetna, it's a different group. So depending on where they go, we want to put multiple options in because we'll be able to toggle back and forth between the different pharmacy options while sorting all the drug plans. And we can actually get a better idea of what the actual lowest cost will be with the most optimal formula of the pharmacy that's selected as a preferred pharmacy. So it can be vastly different too, from one pharmacy to another. WellCare's formulary might not be as strong as Cigna's, but if you pick Giant Eagle in Youngstown, WellCare is going to show up better because they're preferred. But if we pick Walgreens in Youngstown, even though Cigna's formulary is better, they're going to also show up better in cost because they're preferred. It's hard to talk about until you actually see it, but we want to give ourselves as many options as possible so we can toggle back and forth for the lowest cost.
So yeah, a good rule of thumb is firstly, maybe add their preferred pharmacy that they currently use. So you can change which pharmacy that you've listed here is preferred. And you can also change down here which pharmacy you want to see drug costs based on, which I find that to be a little strange. That's an add-on that they did this year. The preferred pharmacy should be the same just from my standpoint, but that is a feature that they did add. So let's close that out. And now let's get to where the real important piece is, which is adding their medications. So I'm going to let Dave chime in on this with a few recommendations, but I want to show you here why I typically recommend that they bring their pill bottles to the meeting that we're going to have. Okay. One of the most common medications that you're going to type over and over again in the AEP is metoprolol. And so if they just write their own list, half the time it's illegible, half the time they leave off the dosage and the frequency, but they almost always, without fail, leave off the second name, okay? And you need that information in order to pick the right medications in here and get them correct on the formulary. Now, fortunately, in the case of this medication, it's pretty readily available. It's pretty strong in every formulary. So there's not going to be, at least historically, a huge difference in pricing between these three versions of one drug. But you do have an extended release, you do have a regular version, and then you do have a combination version that includes a water pill. So obviously these medications are for blood pressure. When they bring their pill bottle, you have all that information at your disposal. When they bring a list, it's confusing for them and it's confusing to you. Plus, we love the physical ability to move those pills from left to right across the desk. As we enter them in, it's a visual cue that I've completed that entry and that I'm sure we're going to get pricing on that medication. So this is an easy one. We know this is regularly going to be a tier 1 drug. We'll pick 50 milligrams. You can change the frequency and the dosage. Dave, do you want to pick a drug? This is like the most fun part right here.
Give me Jardiance.
Good old Jardiance. We type it in, it pops up. We'll do the 10 milligram. Let's do a statin. We'll go with Crestor. Rosuvastatin calcium is the generic. Actually, let me type Crestor in case you've never seen this before. If I enter a brand name drug, here it is. It's going to give me the opportunity to select a generic. There are some people, in particular with thyroid drugs, I've noticed, who have to take the brand name. So don't just assume you can enter the generic. Make sure you ask them if they can tolerate the generic. But it will prompt you if you have the brand name or they can't remember the generic, you can enter the brand, and the SmartEnroll will prompt you to change to the generic. Dave, let's do one more drug. What are you thinking?
Let's do venlafaxine.
Oh, yeah. So which one of these do you want? We got a couple of varieties.
The hydrochloride.
All right. And you want to pick a dosage here?
Well, this is also important why you have the bottle, because the tablet isn't typically covered and it's hundreds of dollars a month, but the capsule is. So let's go the 150 capsule extended release.
So that's such an important point. Again, why we like the bottle. If they don't know the difference between are they taking a tablet or capsule, that coverage disparity could be significant. And we run into that with multiple drugs every year. So good pick there. So this will give us a good scenario for today. Next week, we'll get into some of the drugs that come in as a cream, an ointment, a powder, an inhaler, a pill, a capsule, an injection. And you'll start to see why it's really important that we drill down on having the specifics of these medications. Again, for my return people, this is new and this is awesome. We're not pharmacists. Sometimes I think we feel like we are, but they added a common condition. You can hover over this and see what the common conditions are for those medications. So that's pretty awesome. That's a great addition. So let's close that out and let's look briefly at these other things that we can add now. If they get a subsidy, you can add this. We'll talk about this in a later session. Be careful with this. If you add extra help from Social Security, the pricing that you're going to see for estimates is going to be lower cost. And unless you have the letter in hand that they get from Social Security that says which tier they're going to be at, I would be very cautious about showing them extra help pricing. Because if you're wrong, I would always rather you be wrong on the high side of the estimate than showing them something low, and then they end up having to pay more. But that's what the subsidy box allows you to do. Okay, so I'm going to go, I'm not sure. Add health. My recommendation is that we don't do this. I'm going to click yes to show you what it is. Okay. And this is to help you estimate your out-of-pocket costs on a Medicare Advantage plan. So we could go to update answers and I could have this conversation with my client. So maybe my client has to go for lab every month. I could change this to 12. This is an updated version of this, by the way. Maybe they go on 3 office visits, 4 specialist visits. We're not anticipating an outpatient surgery, so we can update that and click save. We can also add their current plan for comparison's sake. I am going to do that. We'll say they're on a Medicare Advantage drug plan. This is pretty cool, by the way. If you haven't seen this yet, it's pretty cool. We do medical mutual, and we'll say that they're on the secure plan. Lastly, we have a new option here to personalize benefits. So I haven't really played around with this very much so far, but you can see the preloaded benefits or supplemental dental, vision, hearing. See if we go over the counter. Is that an option? No, I'm not very familiar with this yet. It's a new thing, but I don't anticipate using it. So I'm just going to X these out right now. And let's go to plans. So we've added some preferences. Let's go take a look at plans. So really cool for us as agents. There's their current plan already preloaded. I can go ahead and add that to compare. And then we can look at other plans. So Dave, I know we're looking at Med Advantage plans right now. Do you want to talk about the methodology of how we look at these plans and assess them? And then we'll get into how this is going to play out a little bit different starting October 1st.
Yeah, one way you can do it, if you're new to Medicare and you're new to your market, we typically utilize our broker managers. You reach out to your Humana rep, your Blue Cross rep, your Aetna rep, and say, hey, over the years, what are the top 2 or 3 plans that agents are writing in this area. And very simply, they can go right over that. And you can mark those down as kind of your go-to options with each carrier. But if you haven't had the time or you're unable to reach out to the carrier rep, I like to start searching by the maximum out of pocket. Because typically, if you have a low maximum out of pocket and a relatively low premium, you've got yourself a solid plan. And that's sort of a benchmark you can create to compare the other plans with a plan like that meets that criteria.
So we do have some sort functionality here. So we can go ahead and change the sort. Let's look first at total estimated cost. That's going to give me an idea of the lowest out-of-pocket cost for prescriptions plus premium, and that's going to be based on my primary pharmacy. You see CVS Pharmacy. And so I'm going to go ahead and flag Humana as a compare because that gives me the second lowest total estimated cost. Let's click view more information here real quick. It's saying my premium is $12 a month. My estimated drug cost is $174, where my current plan, I'm paying $39 a month with a drug estimate of $627. Total annual cost $1,095 versus $210. If I was making a change right now, Humana PPO would certainly be a consideration, but I got to pay attention to this. The max out of pocket here is $3,350, $5,250 here, but I am picking up a PPO, not an HMO. So let's do what Dave said. Let's go to the sort and let's sort by max out of pocket, low to high. My current plan is still at the top. Again, total cost $1,095. I could go to SummaCare, a lower max out of pocket, and then about half the annual total cost, because this plan has a $152 a month premium. So down at Ruby, $48 a month, total annual cost, $435. Let's add that to the compare. So every year, as we approach AEP and we get more information about the plans, Dave and I like to make a plan comparison spreadsheet. It's similar to what you can do by clicking compare now here, but we can get way more plans from our market on that spreadsheet. And we can go through that spreadsheet and highlight the cells of the leading plans for all these different costs that you see listed here on the left. But this gives us a good idea, a couple of plans that we're comparing. We see the premiums, 12, 39, and 48. We see the estimated drug cost, 174, 157, and 291. That's from now until the end of the year. You see here, effective October 2025, we can change that to November if that person's aging in November or December. And let's go ahead and toggle between pharmacies and see if those drug costs change. So Giant Eagle, no real change. Walmart, no real change. Mail order looks to be the cheapest. So, and that's largely because of Jardiance. We'll take a look at that in a moment. But this toggling option up here lets me quickly scan those different pharmacies. Fair enough. And then I have a side-by-side comparison of many of the plan's benefits. So Humana has the highest max out of pocket, but it's also a PPO. It's also a national network. Where these two plans right here are HMOs. Medical Mutual has an Ohio-only network with emergency coverage outside of the state of Ohio. SummaCare has a Ohio-only network with emergency coverage outside of the state of Ohio and coverage in certain retirement destinations like the Carolinas, Arizona, Texas, and Florida. How do we know that stuff as agents? Market research, going to carrier rollouts, online or in person in our area. okay, studying the plans. And we can go line by line and compare these benefits. It's pretty easy to do. You can see which medications are covered. They all are. You can see which pharmacies are preferred. And so if we start to zero in on a plan, let's say we're going to take a hard look at Summa, we can go to plan details. And Dave, chime in anytime here in the way that we look at these plans or the way that you do as well.
I usually go to the total estimated cost right out of the gate because you entered in some of that potential health information, the doctor visits and so on. It's hard to really predict what people are going to experience medically on these plans, but we know they're going to get their prescriptions every month and we know they're going to pay their premium every month. So I like to start off there once we dive a little deeper to make sure that all their meds are covered and it's the most affordable option.
So do you want to walk through what this means here and why we're paying more the first month, but not the remaining 2 months?
Yeah. And at this point in the presentation too, at our office, we all have a TV screen where the clients can see exactly what we're looking at. If you could flip your computer screen around, or if you have a dual screen, whatever it is, if there's a way that they could look at this too, it really helps kind of break down that trust barrier and lets them see behind the scenes what we're actually doing so they understand it a little better. But in each month, you'll notice they put the premium, $48. They have the estimated drug cost. In October, it's $267. And then since we added in some various health things throughout the year, it gives the estimated health cost to have your total monthly cost at $391. And then we can dive deeper right below and see what they're actually paying each month for their drugs. And if it looks like, man, Jardiance is a lot more expensive than it should be, what's going on? Well, that's because you'll notice that you're in the deductible phase. The other three medications at the top are pretty basic generic meds, so they're exempt from the deductible. But on this plan, the deductible hits anything in tiers 3, 4, and 5. So Jardiance is having to go through the Part D deductible, making that cost a lot higher. And then on top of that, right now, Dave has selected mail order, so it's showing a 90-day supply. And that's why when we look at the next month, all the meds are zero because we're not having to pick up any medications because we just picked up a 3-month supply right out of the gate. If you were to flip back to one of the standard type pharmacies, we see how that changed pretty significantly. Well, actually, still pretty expensive. But that's giving you just 1 month's worth.
So,
and a lot of times, well, go ahead.
Go ahead.
Well, just a personal thing that I've noticed meeting with clients is when they fill this out through Retire Flow, or when they call in with their meds and one of our office girls creates this profile, a lot of times they'll say, well, I get a 90-day supply at the pharmacy of this, but I get this one every month, and this one here I only get every 6 months. Then you've got all these different numbers when you're trying to compare monthly costs. It makes it confusing. So when I put the drugs in, I try to have them put in monthly. So you get one a day, that's 30 per month. We move on to the next one because you can always do 90 days, even if you put in a 30-day supply by clicking the mail order option once we get everything entered in and we're comparing. So I like to keep it on a level playing field and enter everything in on a monthly basis. And that helps us understand what the costs are ongoing throughout the year.
So this is a great screen too, because you can print this out at the top once you get the estimate in place and they decide where the lowest cost is to get their prescriptions. And the print button's right here at the top. So inevitably, you're going to come across a local pharmacy that they love to go to who the prices are going to be higher for. Don't tell them not to go there. Show the next lowest cost comparative. So if it's CVS is the lowest and their local pharmacy is not, print out the list with CVS and tell them, take this to your local pharmacy and see if they can meet or beat any of these prices or if they can do anything to help you. We don't want them to have to leave their pharmacy. Sometimes local pharmacies can negotiate and give clients pricing that we don't know about or that doesn't show up in these rating softwares. In the very least, let them go have that conversation if they want to be there and then equip them with the pricing. Almost every time I've done it, my clients still ended up getting some of their pharmacy or some of their medications from that local pharmacy. Those local pharmacists will refer to you. The chain pharmacies rarely will. Does that make sense? We want to build that referral opportunity by encouraging our clients to at least engage in conversation with their local pharmacy if that's where they already go. If you were new, again, it's probably my favorite thing about SmartEnroll. Let me collapse these months. You might have questions from that client in your meeting about why the prices are different month to month, why the prices are different from one pharmacy to the next. All you have to do is scroll down, and it's all right here for you in black and white. That makes it so easy. You don't have to go look for the explanation. You can scroll down and find it. You can go to the prescription tab right here, and you can literally see what tier each medication falls into throughout the year or for that plan, and then what stage or what the cost is in each stage throughout the year. There's a question mark next to each of these descriptors to help you understand it if you're new in the Medicare space. So Metoprolol, we can see the retail cost, $5.23. On my plan, initial coverage is $0. And then we have catastrophic cost, which is $0 for all medications that are covered now. We see that Jardiance is a preferred brand. So it's retail cost $611.66, initial coverage $47. So why was it more than $47 in that first month? As Dave described, there's a deductible there for those tier 3, 4, and 5 drugs. And again, those descriptions at the bottom with more information at the bottom on this screen about drug pricing. I did, to show you, add in those health preferences and health costs to give you a health estimate. It shows approximately that person, if they went and got 12 labs or x-rays, they would spend $750, and doctor's visits 4 times would be $160. I don't like this. I did it as a demonstration to show you, but we already have enough numbers to help our clients understand without putting in some health estimate based on national norms. Because if you add that in there, like we did in the preferences, now when I look at my total cost every month, it's dividing out that number and it's giving me a $75.83 additional cost to what I'm showing my client here on this estimate screen. It adds confusion. It's a great idea and concept, but those of you who have sat across from clients for years, you know how confused they already are. We don't need to add that number, but I wanted to show you where it ends up. So if this was the Advantage plan that we wanted to enroll our client in, all we have to do is add it to the cart. And then let's show you this. Complete and submit the form. Myself, we would do that if the client is with us in the meeting. If this was a virtual meeting, I could send this to them by phone, by text or email. They can complete it at home. But when you go to apply, again, this is where it's great if you are new to Medicare as an agent. This is a virtual compliant checklist for you. It is reminding you of all the things you are legally required, lawfully required to go over from the summary of benefits. It's on your screen. Put it up on a TV in your office or turn your monitor to the client and go over this. It has a checklist of required disclosures and disclaimers. And from there, a Medicare Advantage plan application is very simple. You're entering in their information, you're choosing the enrollment period, and you're submitting the application. Total time under 10 minutes, I would say, on average. So for now, let's go back to plans. We've kind of gotten all the way through one potential way that, or one case that we might work with that client. Dave had us enter Jardiance on purpose. That's a tier 3 medication with most plans. That, in this case, could drive that person to pick a certain plan over another when we sort by total estimated cost. Now, one thing we didn't show you on this plan page, this is new. You have 2 check boxes up here. If I add non-licensed plans, it's going to show me every plan available in that zip code, even if I'm not appointed with that carrier. I would recommend you do that, because if you come across a carrier who has way better coverage on somebody's medications and still good core benefits and a low max out of pocket, we can get you appointed with that carrier. You can enroll that client in that plan and take good care of them in the process. You also now have a checkbox if you want to see non-commissionable plans or not. You probably want to keep that to look, but you'll see here that SmartEnroll will now flag that plan as non-commissionable. This plan is non-commissionable. Non-commissionable. So you see where you could have a little bit of a catch-22, where in this market for those medications, some of the lower total cost plans are indeed non-commissionable to me as a broker. So if I look at their current plan, it's non-commissionable. Now, by virtue of what I did in the fall with Dave, we did a ton of sales events for this carrier. And these people came into our meetings after this plan turned non-commissionable in AEP. And they wanted the plan because we presented it in our sales meetings. For 5 or 6 times, we did these big presentations. So we ended up having to write a lot of non-commissionable business. And that didn't feel very good at the time. It was actually this plan down here that we wrote the most. But what we're now hearing is maybe that plan will be commissionable for those renewals this year. And so we're going to do the right thing for our clients. And in the end, it'll all work out for us, which is what's happening in that specific instant. But if I'm looking at this, right, we have the lowest total annual costs. Let's go find the next commissionable plan. And let's compare again. Both of these plans that we looked at previously are commissionable. Let's go to mail order again. So how do I, as an agent, present this to a client if this non-commissionable plan has a total estimated cost of $272? Well, it's pretty easy if I do my market research, right? This plan has a lower estimated cost, and it's going to pay me to be your agent and to take care of you for the rest of the year. So we have to learn the differences between the plans. We have to do market research. We want to make sure that we're really well versed in Advantage plans and the differences between them and their offerings. Because I want to show you one more thing. Dave's going to know right where I'm going with this. We like the ability to sort and present plans by total estimated cost, but there's one big problem. One of the top plans in our area does not show up for a while. Let's talk about why. for a minute. This plan from United Healthcare is $29 a month. And you can see the total cost is $639, where with this medical mutual plan, the total cost is $272. But not all things are created equal. So medical mutuals plan, a $3,350 max out of pocket, $3,900 over here with United Healthcare. If you live where we do, and you have medical mutuals plan, and you want to see a specialist at UPMC in Western Pennsylvania, which is a preeminent hospital in the country, you can't go on that plan. You have an Ohio-only network with emergency coverage outside of the state of Ohio. So you might assume a little bit more risk over here, right? On your medication cost. A little more risk, a couple $100. However, you have a national HMO network. So what if you live part-time in Florida or you live part-time in Tennessee and you're a snowbird? What if you want the security of having both of those mega power hospitals, the Cleveland Clinic and UPMC? What if you want to be on the plan that has historically been the most stable in our market, year over year over year? That is where agent research, training, market research comes into play and helps you be a good advisor and agent. You also want to diversify your book. You don't want to fall into the trap of always writing the same plans, especially Advantage, over and over and over again. Because if you have a major carrier leave your area, which is happening a lot this year in certain parts of the country, in our state, your state, you don't have to move everybody in the event that that plan leaves your market. So there's similarities and differences between the plans, which is why we have to do our market research. It's a lot of reading, but as we scroll down here, this is another thing I love about SmartEnroll. We can access in the details for each plan the full summary of benefits document. And this is what I pull data from to make my spreadsheets as soon as they become available at the end of September, early October here. You can see the full summary of benefits right in SmartEnroll. You can also go to the carrier's pharmacy directory for that plan, prescription directory, and like we talked about earlier, the provider directory. We love to show this in our meetings with our clients because it's teaching them how to find it when they need it. So here's the provider directory page. How do we find medications on this page? So we're going to demonstrate that in our meeting as we look it up for our verification standpoint. Super easy. We picked the plan, and now we're doing provider lookup for our clients in that meeting with the carrier that they're considering applying with. I'm going to share that link with them right here so that they can have that if they want to look up providers throughout the year. So that was a basic walkthrough, start to finish, working with one client, trying to show you some of our methods on how we do plan comparisons. And next week, we'll get a little more into standalone Part D plans. We'll show a little bit about supplement plans in SmartEnroll, and we'll do another Advantage plan case. Dave, I've been talking for a while. You want to fill in any gaps or talk about anything that you observed in the chat while we've been recording this here?
Yeah, I would say for newer agents, oftentimes this could be really overwhelming. And sometimes they're in a situation where they are almost afraid to enroll somebody in an Advantage plan in fear that they might make the wrong decision for them. While that could potentially happen, by and large, all the plans are really pretty similar. So as long as you're confirming that their doctors and hospitals are in the network and that their prescriptions are covered, it's hard to really put somebody in a bad situation. Every plan is approved by CMS, so it's got that designation. Most plans are 4 stars and above. So don't be afraid to make a good comparison and change somebody to a plan this AEP, because as long as you're checking those main core boxes, the odds are you're going to be doing the right thing for that client.
Yeah, I'd say the big overarching fear for Advantage Plan, we're fortunate where we live in our market that we have a lot of really, really good hospitals and provider networks. We're an hour away from Cleveland Clinic, UPMC, University Hospital, which is through John Carroll, right? Ohio State University Hospital is 2 hours, 40 minutes away. SUMA in Akron has become a very reputable hospital system. That's not true for all of you, every place that you're at in the country. So the one thing you want to be judicious about with Advantage Plans is making sure that you have multiple hospital options and huge doctor network options, because it's frustrating, but the negotiations for contracts for Advantage Plans are not annual with January 1st as the end and start date. They come up when the terms of that agreement comes up. So you could have a major network disruption on an Advantage Plan in your area, really whenever that carrier and that provider network or hospital entered into that agreement. So we want to be mindful of that. Other than that, what Dave said is exactly right. They're vetted plans, they're approved by CMS. We have good client experiences with Advantage Plans. And I think if we've learned anything, it's like we said, diversify. Don't jump hard at the new guy in town. It's like the Apple update. Sometimes you need to sit back and let things play out a little bit and see how well that network is really going to look, or how well balanced that network is going to look.
And remember, you're selling health insurance. Not dental, over-the-counter, hearing benefits. While those could be important, many people get distracted and go with the highest level of dental, and they'll give up some of the better, more important core benefits with another carrier.
So true. And some of the core benefits that we really focus in on are the doctor and specialist visit, the hospital surgical copays, the outpatient therapy copay, I think is really important for us to pay attention to, because that can add up very quickly. It's a per visit for most plans. We want to keep an eye on the ambulance. There's some carriers that cover land and air for the same copay amount, and there's other carriers that charge 50 or more % if you need to take an air ambulance life transport. We look at imaging costs. We look at lab costs, the ER, urgent care. And we also look at medications. And then we also do look at those extra benefits, but they are called extra for a reason. We want to focus on the core medical, like Dave said, and make sure people have really solid medical coverage with a manageable premium and a manageable max out-of-pocket risk.
Dave, do we have 2 more minutes?
Go for it.
All right. Could you go to Humana and click on plan details? And then I often forget about the option on the right side to send quote. So to piggyback on what Katie was asking in the chat, like how do we make sure they read everything and we've checked all the boxes, and you don't even have the option to do that on the application if you're sending it to the beneficiary? Well, if we email them or text them the quote, we can go down a little bit, Dave, go beyond that.
That's far down as it goes.
What? Don't you usually have the option?
Oh, there you go. You got to check an email first. There you go.
Oh, okay. So you could add in the summary of benefits. You can add in the star rating, the evidence of coverage, which is everything they need compliantly. And it's everything they could ever imagine reading through about the plan. And when you send that to them in the quote, they can review it on their own time. And actually through your link, enroll, and you are still the commissioned agent. You still get the agent of record, and you don't even have to follow up with them. I've done that multiple times. If we're really busy during AEP or somebody just wants to shop on their own, boom, I'll send a quote of 3 plans. It's got the comparison of their drugs. They can take the time on their own and review it, and then enroll without even calling us back. And we're still the agent of record.
And if you do the enrollment with that agent in your office on SmartEnroll, it gives you this ability to email them these documents as well, which I would always recommend you do because it's a cover yourself, right? Tell them that I'm going to email you the full summary of benefits and evidence of coverage and star ratings and formulary list. That covered you. You've distributed those documents to that client. And SmartEnroll makes that pretty easy to do, right, Dave?
Mm-hmm.
Looks just like this when you at the end of their application. So with that, I think we're at a good place to stop for this week's session. Thank you all for joining. If you're listening to this after the fact on our YouTube, feel free to join us for our upcoming sessions. We're going to keep working through it. I will hopefully next week have a template for this year to show you how we kind of create our plan, the comparison template for Medicare Advantage plans. It really is a helpful way to help you dig deep into what Dave said, which is which plans have the top core benefits for our clients. And that's really what it's all about. It's protecting them from huge medical out-of-pocket risk. And the last thing I want to stress about Med Advantage plans, if someone is in front of you who's turning 65 and they take Part B medications, we can't say this enough. Make sure they understand that they're going to be paying 20% on almost every Advantage plan that I've ever seen. Actually, every Advantage plan I've ever seen. They're paying 20% of the cost of Part B medications. So if I'm meeting with you and I'm on chemotherapy, I'm paying 20% on that Medicare Advantage plan. If you put me on Plan G when I'm eligible, I'm paying a $257 one-time annual deductible. We have to recondition ourselves to be very mindful about Part B medications because more and more people are using them in the form of immunotherapies. There are these new IV treatments that people go get at a clinical location for certain cancers, certain digestive issues, Crohn's and colitis, and many, many other conditions are now being treated with Part B drugs. We'll talk more about that next time. Thank you for spending time with us this afternoon. Dave, thanks for being here and sharing your expertise with our partners. And we wish you all a great afternoon.